Hello, my name's Eric Fowler. I'm a licensed certified genetic counselor, and I'm one of the managers of clinical genetics at Cancer Treatment Centers of America. Today, we'll talk about the importance of knowing your family history, and some specific topics we'll go over are factors that can impact cancer risks, overall risks for cancer in a lifetime, family history and how that information impacts cancer risk, and how cancer risks can sometimes be inherited. The overall risk or chance that a person will develop cancer in a lifetime is impacted by a variety of factors. And each person has their own risk for developing cancer, even identical twins. Some of the risks for cancer we can impact, such as our diet, our lifestyle, and others are completely out of our control, like our family history or our age. Overall, cancer is a very common condition. According to the American Cancer Society, about 1 out of every 3 women and men will develop some type of cancer in a lifetime. There are many different factors that are involved in a cancer occurring. Some include environmental factors, such as what we're exposed to as we go through life, chemicals, pesticides, radiation. Lifestyle also matters. Our diet, our exercise habits, whether we smoke or drink alcohol. Also, genetic factors come into play. Those genes or risks that we may have inherited from our parents, passed down from generation to generation. Also, as we get older, the risk for cancer goes up. And other things which may combine to impact the overall risk of cancer include our immune system, certain hormones made by our bodies, and also our detailed family history information. All of this works together to give each of us an overall risk that we may develop a cancer in a lifetime. One of the important things in terms of information that we can gather is knowing more about our family histories of cancer. My suggestion is that people should write down what they can recall about their family history, including who in the family has had cancer diagnosed, how that person is related, and what side of the family that person is on. So for example, if someone had a maternal aunt that had cancer, it'd be important to know where that cancer started, say the breast, the colon, and not where that cancer may have spread to. Another key piece of information is the age that family members were diagnosed with cancer. If you're uncertain about your family history, it may be helpful to talk to relatives because other family members may know information that you don't. Also, it's helpful to know where your family came from originally. What country or countries did your ancestors come from? And whether there may be any Ashkenazi or European Jewish background in the family. In people who have Ashkenazi Jewish heritage, there are higher risks for breast and ovarian cancer due to some of the genes that we'll talk about later in the presentation. Death certificates may also provide information that the family may not remember. These can be obtained in the United States from the county where a family member died and may provide some detailed information about what cancer that individual had. Cancer risks really increase based on several factors when considering family history. First, when relatives are diagnosed with cancer at younger than average ages, this can increase the risk more than if relatives are diagnosed at more typical ages. Second, if more than one relative has had the same type of cancer or different cancers that may be related due to an inherited risk, such as breast or ovarian cancer, that's important information. And also, when closer relatives are diagnosed with cancer, that impacts the risk more than when distant relatives are diagnosed. And when we think about how closely relatives are related to us, we think in degrees of relationship as far as genetics. The closest relatives are considered first-degree relatives, and these would be parents, brothers, sisters, and children. The next step out would be second-degree relatives, which would be grandparents, grandchildren, aunts, and uncles. And then a step beyond that would be third-degree relatives, such as great-grandparents, cousins, and great-nieces and nephews. So these degrees of relationship are important when thinking about how the risk may translate to you. If we think about specific cancers and how family history may impact risk, that is also very helpful information. For example, a family history of breast cancer does impact the risk. The average woman has about a 1 in 8 or a 12% risk of developing breast cancer in a lifetime. If a woman has a mother, father, sister, or daughter who's had breast cancer, the lifetime risk is about twice what the average risk would be, or about a 1 in 5 or a 20% chance. Colon cancer also can impact risk when there's a family history. For example, the average person has about a 1 in 16 chance of developing colon cancer in a lifetime, or about a 6% chance. But if someone has a mother, father, brother, sister, or child who's had colon cancer, the lifetime risk is about twice what the average person's risk would be, or about a 1 in 8 or 12% chance in a lifetime. Prostate cancer can also be considered in a similar light. A man who has any close relative, a first-degree relative like a son, a brother, or a father who's had prostate cancer has about twice what the average man's risk would be. And risk actually varies for all of these cancers based on the numbers of relatives who've had those cancers in the family. How or why is this information important? Family history of cancer may impact recommendations for cancer screening. This is why it's important to share this information that you've discovered with your physicians so that they can consider the family history when making recommendations for cancer screening. Depending on what the history is in the family, depending on what the relative's cancer diagnoses are, what types of cancer they've had, what ages the cancers were diagnosed, screening for certain cancers may be started at younger ages and be repeated more often. For example, if a person has no family history of colon cancer or no other risk factors for colon cancer, typical recommendations are to have the first colonoscopy at age 50, and if nothing significant is found, repeat that test in 10 years. But if a person has a sister who had colon cancer at age 50, they should have their first colonoscopy by age 40, which is 10 years younger than when their sister was diagnosed. And with normal results, repeat those colonoscopies every 5 years. So this is not only starting at younger age for colonoscopies, but also repeating the test more often than the average person would. When I look at a family history, sometimes I'll see a cluster of cancer in a family, meaning 2 or more people in the same family who've been diagnosed with cancer. This is not an uncommon finding in families. Why do we see clusters of cancer in families? Sometimes it's because of unrelated causes. There may be different reasons why people in the same family develop cancers. Some may have had an environmental exposure, others it may be more hormonally related. Also, as families, we typically share environmental exposures because we live in the same place. We have the same exposures to potentially harmful things in the environment, and we often learn our lifestyle habits from our family members. So these shared exposures and shared lifestyle habits may also work to cause a cluster of cancer in a family. And sometimes family history by itself impacts risk, as we've been discussing. And then finally, in some families, there may actually be an inherited risk for cancer, which can be passed down from generation to generation in a family. And we'll talk more about that in some of the upcoming portions of this presentation. First, I'd like to tell you a little bit more about genetic counseling. There are about 4,000 genetic counselors in the United States, and so there's not many of us in the US, and we work in different areas of medicine, some in oncology, like me, and some in other areas. But genetic counseling is the process of helping people understand and adapt to the medical, psychological, and familial implications of how genetics contributes to disease. In practice, as a cancer genetic counselor, I take detailed family histories so I can interpret that information, as well as look at medical histories for a person and in the family. I educate people about genetic information, including inheritance, genetic testing, how medical management may change based on a genetic test result, even ways cancer can be detected early and prevented if we find an inherited risk for cancer. And importantly, I work to counsel people to really empower them to make informed choices relating to cancer risks and genetic testing. Not everybody who's offered a genetic test decides to proceed, and it's each person's right to make that decision for themselves. A directory of genetic counselors can be found online at www.nsgc.org. So overall, how much cancer is hereditary? We think it's about 10% of all cancer diagnoses have a link to an inherited risk. About 20% of cancers are familial, meaning that there are multiple people in a family who've had a cancer diagnosed, but not necessarily because of an inherited risk factor. And about 70% of cancers are sporadic, meaning that that person is the only individual in their family who's had a cancer diagnosed. When a family history is evaluated, there are certain things that make it more likely that there could be a hereditary risk for cancer in the family. Is there cancer in 2 or more close relatives on the same side of the family, especially if those are the same types of cancers? Were family members diagnosed at earlier than average ages with cancer? And we typically draw a line at age 50. We can see inherited risks when people are diagnosed after the age of 50, but in terms of looking at ages, 50 is a dividing line in terms of the age cancers occurred. Did a family member have more than one type of cancer? Not cancer that spread from place to place, but different cancers that started independently of each other. Also, are there potentially bilateral cancers, meaning cancer in paired organs like both kidneys or both breasts, or a specific list of cancers or type of cancers that happen in the family? Even though they're different, they could track back to the same inherited reason, such as breast or ovarian cancer in the same family, or even colon or uterine cancer in the same family. Also, we look to see, is cancer in more than one generation in the family? Is there a generation to generation pattern of cancer development where maybe a grandparent had cancer, one of their children had cancer, and then even a grandchild? And sometimes there are aspects of a personal or family history that aren't cancer related, but could suggest the possibility of an inherited risk, possibly certain skin changes or other aspects of medical or health findings that you wouldn't think would be linked with an inherited risk, but could be. And genetic counselors are specially trained to look for this information. Over the past 5 or 10 years, we have been finding new genes that are linked with inherited risks for cancer. Some of these genes increase the risk for multiple types of cancer. Some are more focused on a single type of cancer. As far as breast cancer is concerned, the 2 genes that were first discovered are called Braca1 and Braca2. And we will talk more about these genes a little bit later in the presentation. Braca stands for breast cancer, and the numbers 1 and 2 were the order in which these 2 genes were discovered in the mid-1990s. Later, another gene called CHEK2 was discovered, which also has a link with inherited risks for breast cancer. And there are a number of other genes that would fit in this category as well. As far as colon cancer is concerned, the first two primary genes that were discovered are called MLH1 and MSH2. And there are many other genes beyond these, but these were the first two genes found that cause a condition or are associated with a condition called Lynch syndrome, named after Dr. Lynch, who first discovered it in the 1960s. And prostate cancer, we found one gene that is prostate cancer specific in terms of inherited risks, and it's called Hox B13. So this is just a small list or sampling of the genes that we have discovered over the years that are linked with inherited risks for cancer. There are many others, and I also believe that there are a number of genes that we have not discovered yet that will become important as they become found. How do we search for an inherited risk for cancer? The type of testing to accomplish this is called genetic testing. And genetic testing is usually done on a blood or a saliva sample. Most insurance companies will cover the cost of genetic testing if personal and family history criteria are met. And these can vary from one insurance company to another. So that's why a detailed review of the family history by a genetic counselor is important. Genetic test results take a few weeks to come back typically, and there are several possible results that we can find. We may have a positive test result where we did find an inherited risk for cancer. That test result will now help other family members who may be interested in having genetic testing on their own. Test results could be negative. We may find nothing, no changes of any kind, no evidence of an inherited risk for cancer. However, cancer risks could still be higher just based on the family history, or there may be a gene in the family that hasn't been discovered yet. And finally, results can also be inconclusive, meaning we found a difference in one of the genes, but that difference is of unknown significance. It's different, but it's not clear whether it has any impact on the risk of a cancer occurring. What are the benefits of genetic testing? Well, it may help a person and their family have a more accurate understanding of what their risks for cancer are. If an inherited risk is found, it provides that level and detail of information. It may help inform medical management decisions such as when to start screening for cancers, what tests to have. May reinforce the importance of a healthy lifestyle. Also, we could have very different options for the prevention of cancer if we found an inherited risk. So this information is translated directly into medical care if a positive result is obtained or an inherited risk for cancer is proven. The information, once the initial relative is tested or family member is tested, may also help other family members. If a person tests positive for an inherited risk for cancer, their children, brothers, and sisters would each have a 50% chance that they've also inherited that risk factor. Not everybody who's offered genetic testing decides to proceed with the test. There are definitely considerations for genetic testing. These may include the emotional impact of finding out there's an inherited risk for cancer. Such information may cause distress, anxiety. We also think about the age at which we offer genetic testing. Some genes primarily increase the risk for cancer in adulthood. Others may impact children. So it depends on what gene we found the inherited risk in terms of the age at which we would offer genetic testing. Insurance typically will pay for genetic testing if medical criteria are met, but there may be a cost associated even when criteria are met, so that's also an important consideration. Genetic test results, like other medical information, is confidential, and it is kept in the medical record, And thankfully, we have laws that have been passed that prohibit certain types of genetic discrimination. The concern or question has been, could knowing there is an inherited risk for cancer, and therefore a higher risk for cancer, be used in some way to discriminate against a person? Two of the laws that have been passed are HIPAA and GINA, and these laws specifically provide protection against genetic discrimination in health insurance and employment. Another consideration for genetic testing is results are not always informative. There may be a very strong family history of cancer, but the genetic testing may not provide us any answers. Positive test results definitely do change medical management in terms of increased cancer screening, starting at earlier ages, and also potentially preventative options for cancers as well. Also, if we do find an inherited risk for cancer, there may be people in the family who did not inherit it. So knowing this can help those people to understand that they are at average risk to develop cancer. Some of the examples of tests that may be done earlier or more often when we know there's an inherited risk for cancer include, but are not limited to, mammograms, breast MRIs, breast ultrasounds, colonoscopies, and even other screening tests. And there are options for preventing cancer, which may include taking certain oral medications, in some circumstances, surgeries. And this is a very new area in terms of how genetics meshes with cancer care. But in some cases, depending on genetic test results, there may even be different treatments for cancer that are available. To come full circle and bring this information together, I'd like to review information about the BRCA1 and 2 genes and the risks that are associated with these genes when someone has a mutation or inherited risk. The highest risk is that for women to have breast cancer if they have a BRCA1 or 2 mutation. Risks range from about 50% potentially up to a 90% chance. With this information, earlier screening for breast cancer starting in the mid-20s, doing more tests to screen for breast cancer is important, and also considering ways that breast cancer could be prevented. The second most common cancer that we see in families with BRCA1 or 2 mutations is ovarian cancer, with a lifetime risk between a 10 and close to a 50% chance. This is a difficult cancer to detect, so there are recommendations for the surgical removal of the ovaries after childbearing is complete, usually by the time someone is in their mid-30s to mid-40s. Breast cancer in men may also happen in families with BRCA1 or 2 mutations, so there are recommendations for breast exams for men, as well as prostate cancer. Higher risks for prostate cancer have been reported, and so recommendations for prostate screening begin earlier rather than at the typical age. And there are increased risks for additional cancers, including pancreatic cancer and melanoma. So you can see this wide range of risk, and we address that risk with closer screening, preventative options, with the goal of detecting cancers early or potentially preventing them. In summary, there are many factors, including family history, that impact cancer risks. And when possible, it's important to gather that family history information so it can be shared with physicians. This information can then be used to guide medical management. About 10% of cancers, so not the majority, but about 10% occur because of inherited risks. And genetic counselors are uniquely trained and qualified to assess the chances of an inherited risk for cancer by taking a detailed family history. Genetic testing may be offered based on family or personal history information, and people who have inherited risks for cancer are followed even more closely than would be recommended based on family history alone. Thank you for joining me today. I hope you found this information on genetic counseling, genetic testing, and cancer risks helpful. For more information, please visit cancercenter.com.